All right, Mr. Chair, you can call the Tri-Town Board of Health September 22nd, 2021, 6 p.m. Tri-Town Board of Health meeting to order. It's being recorded.
Okay, thank you, Jim. So may we have a motion to approve the 9/2/21 minutes?
I make a motion to approve those minutes.
Second,
All in favor?
Aye.
Aye.
Okay,
Hey.
good.
The board beat me so fast to the minute share, I didn't even have time to pull it up.
All right, so we're meeting tonight basically to review what's been happening with the coronavirus pandemic more locally. Jim, you want to give us a report since what happened the last meeting?
Sure, Mr. Chair. In a second, I'll actually pull up some COVID update numbers for the board and those watching from home. So basically, from the September 2nd, 2021 meeting of the Tri-Town Board of Health, the board enacted a COVID-19 directive, which was approved that night, that really sent out a strong community message to rally community members together to really ask people to mask indoors, outdoors, if they can't social distance, and some other language about reconsidering events if you couldn't social distance. So that was passed on September 2nd. Zach and the team immediately thereafter sent it out to several people in the community, including all the boards of health, all the chambers of commerce, all permit holders. We asked the chambers to disseminate it out to other people in the community. We updated websites. I spoke to the Berkshire Eagle. A lot of communication happened, sending it out. And I think overall, and I'll have Zach chime in a second because he got quite a few calls. What I want to say is, from my perspective, is while we can't go out there and inspect every single business, whether we permit them or not, there really seemed to be a rallying of the community that really welcomed the directive, regardless if there was confusion or not, if it was a mandate versus a directive, and whatever how people interpret that. The chambers stepped up, all three towns. Select boards have stepped up, all three towns. We got multiple phone calls from businesses that thanking us that we were doing everything in our power to keep them open. Several restaurants were affected by shutdown due to staff being affected with COVID. So I think overall, I think our message was loud and clear. Is it 100%? Probably not. We did get a few phone calls basically asking, to clarify the events, which I'll get into very shortly. And I did send out some amendments, possible changes for the board to look at. Because if the board recalls, I think the intent was to really look at these larger scale events, but we didn't put a number on that on the first iteration of the directive. We just said events. And so I think some folks interpreted that as, oh boy, I got to cancel my wedding next weekend. And so, we fielded a handful of phone calls there. And so I reached out to some of those folks and I was like, no, the intent is to really push the masking. And, although we didn't put a number on the events, the intent was really to focus on these large scale events. And then we got some other phone calls regarding, like, for example, Austin Riggs, they're a congregate care setting, and in certain settings, they can't mask indoors completely. So other calls were, okay, do I have to mask my kid during a 20-minute recess at school? So I think, we were able to inventory a chunk of those clarifying concerns, and I did put those into an amendment, which I'll pull up in a second. I also want to introduce Amy Hart, who's our Southern Berkshire Public Health Collaborative nurse leader. Amy does a weekly dashboards for Southern Berkshire County that gets disseminated every Friday evening with a with a very in-depth analysis of what she's seeing from week to week. And she also provided me today with a kind of a snapshot, and I'll pull that up right now and we'll look at that. But I would say overall, I think the community responded really well, and I think that was the board's intent, to really do a strong call to action. Some people are asking, when does the directive expire? And I think what we're telling people is the boards are committed, the Tri-Town boards are committed to meeting routinely. We're going to constantly be looking at the data, and hopefully things continue to slide down consistently, and the board can reconvene and make a decision as time allows. And so what I'll do real quick is I'll pull up what Amy sent us today, and I'll, and Amy, you're more than welcome to chime in. So basically, this is a breakdown of the cases from Lee, Lennox, and Stockbridge. Initially, we had July and August when the board implemented the directive, so we have August and September. And so, Amy, if you want to give what you're seeing between you and Jill on some of the issues, I think the majority of the cases are still coming from household spread. And I'll just turn it over to you if you want to just give a quick overview to the board of what you're seeing.
Yeah, thanks. Hi, everybody. Thank you, Jim, for the chance to join and introduce myself and just say hello to everyone. We're really excited about working together. And Jill has been wonderful and Jim's been wonderful. It's just been a great collaboration for the past few months. What we've been seeing most recently, as far as COVID transmission goes in the community, is it continues to be primarily household spread. As Jim mentioned, we have seen some workplace spread, not a whole lot, thankfully, but some for sure. And this is one reason why the mask directive is a good idea for indoors. Looking out beyond the tri-towns, we've certainly seen some outbreaks happen, even in an outdoor setting, actually, over in Otis. And so we know when people are close together, the high infectiousness of the Delta variant, which is now, as most of you I'm sure know, nearly 100% of the new reported cases in the Northeast, as well as across the country. So we are really considering all the opportunities that this virus may have to transmit amongst our community. In this chart at the top, I just shared an update with Jim. Of course, we're only into the third week of, we've completed the third week of September, so it's not a true comparison, but I was able to essentially adjust what we would have expected to see by now based on last month's trend. And we can see, I'll just direct your attention to the far right column. Things are looking, been going down. And I also let Jim know that we are seeing a similar drop happening in Great Barrington. I don't have the actual numbers for Pittsfield, but I know that they are having a drop as well, just based on the state 2-week reports that they put out every Thursday evening. And we'll look to see how things are doing tomorrow evening, and we'll see how the county is looking overall. But we're seeing things are improving. Some of this we expected with the sort of departure of our summer visitors. Some of this we, expected with maybe cancellation of certain things and just sort of everyone masking up again, reduction in transmission. But as you can see from the second column with the September numbers, we're still seeing a fair amount of transmission. And as I highlighted in the graph in last week's dashboard on Friday, we are seeing continued growth in the youngest age group. And, part of this we just have to acknowledge is that those kids are being weekly pool tested now. And so we are going to be catching asymptomatic cases, which would otherwise go undetected unless it was a known exposure and then they were being checked at their doctor's office. So this isn't terribly surprising. We also know that the vaccination rates tend to be lower generally from the 20 to 50-year-olds. And so not surprisingly, we see, especially the 30 to 50-year-olds, a higher number from when Delta started to arise in the Northeast region up through mid-September when I ran that data set. And then as you can, going back up to the chart at the top, we see that the percentage of unvaccinated new cases continues to be not the majority, but pretty high. Now, we don't expect to see majority of unvaccinated cases because we do overall have such a high vaccination rate in our community. And some of this is just demographics, where you have a larger proportion of older residents, and we have a much higher vaccine uptake within that group. We are going to see that when there is breakthrough, we're going to be seeing that among some of our older residents who may have had the vaccine earlier, who may have underlying health conditions that make them more vulnerable and less able to fight off an exposure to the virus. But still, I would say around, as you can see here, between a third and half are unvaccinated. And so we're still working on getting that last group vaccinated. Of course, this involves children as well, and we're hoping that to soon see emergency authorization for the 5 to 11 age group. And if anyone has any questions, I'm happy to answer those.
Yeah, leave it open to Mr. Chair and the board members if they have any questions on the data. No?
Well, I have a question, Amy. I just want to make an observation here. Now, of course, that we're looking at the community transmission in the Southern Berkshire towns, including the Tri-Town area. The current 7-day case rate is 136 per 100,000. The previous 7-day case rate was 174 per 100,000, but both of these are still in the high transmission rate zone that is a trigger for the CDC's recommendation to mask indoors if you can't, and if you can't socially distance. Is that right or not?
That's absolutely right. And I know that it's hard to read the small fine print on this screen. But yes, anywhere above, and I'm even squinting here, I believe it's anywhere above 55 cases in a 7-day case rate per 100,000 would be the significant level of transmission in a county. This is, by the way, this is classified by the CDC. We are half of the county, and so I'm using a county reference. The state of Department of Public Health does have a city by city reference, but that didn't seem really appropriate when we started to look at our regional trends. And then anything above 100 per 100,000, which of course we're certainly at, that would be high transmission. So the CDC's recommendation across the US for both vaccinated and unvaccinated people is for any time transmission has been in the significant or high categories, so orange or red, they are recommending universal indoor masking in public settings and in outdoor settings where distancing cannot be maintained. So we are in line with that when we do things like mask advisories and directives. Now, the CDC does not say, for how long that trend should be maintained at a certain level before we make a change in that practice. But I think, that's certainly going to be a local decision, and it'll have to bear in mind what kind of transmission we're seeing. If it is primarily, let's say, nursing home residents, that might be different than if we're seeing primarily household and other forms of community spread, right?
Thank you, Amy. That was very, very interesting. Does anybody have any report about their local community response to the directive that we put out several weeks ago?
I do. I spent a couple of days just walking downtown in around some of the stores, just to ask them how they felt about it. Several stores thanked us for, not going to say for making us the front, for being able to say this is the Board of Health's decision, not my own. Not one of them were against it in any of the places I went. So everybody seemed to be satisfied that this was the way to go.
Well, that's good. Anybody else?
I've gone in some places. I went into a well-known store in West Stockbridge today, and the store owners were not masked. I was. it's about 50-50 at the post office in Stockbridge. I've not heard any complaints, but I've not seen, total compliance either.
Of course, the post office isn't in our jurisdiction. Isn't that correct, Jim?
Correct.
Unfortunately, it's a federal owned property. We went through that during COVID shutdown as well. We struggled with the post offices. Yep. We actually got Rep. Neal involved and still didn't get much traction on the federal post offices.
Okay, so now, Jim, you've because of your various communications with people, you've set up a set of amendments. But before we get to that, well, all right. Well, why don't we do? Unless anybody in the board objects, why don't we let Jim show us what these proposed amendments are? Then we can go ahead and discuss it. And then, unless anybody objects, we could ask people in the audience to weigh in and give some of their opinions about it.
Yeah, and I'll pull it up. And as I'm pulling it up to respond to Ray's point, so we've gotten some phone calls, with certain stores not putting up the mask, and bear with me as I pull this up. And so, we do have a directive, and while some people can interpret it as a mandate with no enforcement, what we're doing is Zach and I and the staff are responding back to those places that don't have the signs up. And, it's a good communication. It's, we're not being punitive. We're not being forceful. It's, hey, a directive was passed. Here it is. Go to the website. Here's the signs. We're asking you to put this up. And, and one thing I want to stress as we dive into the potential amendments here is, we're also not asking people to risk their safety on, confronting people walking in that are just flat out refusing to wear a mask. We don't want people to put themselves in harm's way. And, and I did get a call from one of the police chiefs that they got a call a couple weeks ago, where the store owner was telling the customers, you need to put the mask on, and the customers were rather difficult. And so we're trying to ask for voluntary compliance here, but we don't want to put people in harm's way either. While we appreciate store owners really stepping up to the plate, we also don't want them to get confrontational with anyone where they can get hurt either. So, I'm just throwing that out there. So here's the potential amendments that I'm asking the board to weigh in and possibly vote on. And so really it's number 5. It's really clarifying events. So let me just read the amendment first, and I'll explain the rationale of the 5,000. So large outdoor events with a capacity of 5,000 or more shall consider postponement where social distancing of a minimum 6 feet per person cannot be maintained. Events less than 5,000 shall implement mitigation strategies such as masking and social distancing. And so where that 5,000 came from is, if the board recalls, back in May, as we were getting ready to open things up, before the state of emergency was lifted, the state actually started allowing parades and other certain size capacities. And so at that time, it was 5,000 or less was allowed, and 5,000 or more had to actually submit to DPH a safety protocol. And so it wasn't just a number we just threw against the wall. Hopefully it stuck. It's really, I think what we're really intended to really focus on these large scale events that could really cause us some challenges with COVID spread. And so that's the first amendment, is to really focus in on clarifying these large events that we're asking people to seriously reconsider. And most of those large scale events have already been canceled and or postponed, and I'm aware of. There's a few small ones that we're getting some phone calls. There's a downtown Halloween thing in Stockbridge. We're working with the chamber on that, but it's also with a population with unvaccinated kids. So it's something we're trying to work together on. I heard today at Pittsfield, it canceled their Halloween parade because of that, and they don't even have a directive or a mandate. I think people are just willingly just trying to postpone. There are other smaller events like the trunk or treat in Lee that's going to be COVID safe with a drive-through, limited exposure. So I think there's some flexibility with good mitigation safety protocols with events less than 5,000 can be had. Further along, that's the only actual change in the directive itself. The other amendments are really what I had a typo on cdc.gov. For some reason we had org. That's my fault. And really, number 2 and number 3 of the exemption is really, it basically what we're saying is right now schools have to follow DESE guidance for indoor universal masking, and part of their guidance doesn't mandate like recess, for example, outdoors where kids are socially distancing. So what we're saying is, but then there are private schools out there that don't have to follow DESE standards. So what we're saying is all schools must comply with the minimum standards set forth with DESE. And I don't know, so the masking order for DESE goes through October 1st. We haven't heard if that's been extended yet. So even if depending on what's going on, I'm assuming that they're going to extend this because we're not out of the woods yet. And then number 3 was really the congregate care settings, like Austin Riggs had called and said, well, they follow Department of Mental Health and we're licensed by DPH. We're following all their standards and guidelines. And so I think it made sense to throw that in there with certain settings that just can't mask indoors. We're allowing that exemption that they're following some other standard, not within this directive. And that's really the amendments that, based on the community response that we've got, that we've inventoried, other than people just upset that masking in general is a bad idea. I mean, we don't want to break the spirit of the directive, and I think these changes don't do that. Keeps the directive intact, but adds a little bit of clarification, if I may add.
Okay, thank you, Jim. Anybody have a comment on that? Okay, well, I personally, I think that there's been generally a positive response in all of the places that I've looked at. And certainly, for example, the Josh Billings just went off, and I think that was a very well organized. The organizers of the Josh did the best, everything they needed to comply with our directive, and I thought that went off very successfully and was a positive boost into the morale of the county. I think to have that Josh happen like that. I think that my feeling about masking is, and I do understand that some people somehow want to muster an objection to it, but it's such a minimal intervention. It's such a minimal intervention to potentially save somebody from getting very sick or dying. And this is, I think, it's hard for me to understand why people will not step up and mask when they know that that's the purpose of it and it actually works, even though it's not 100%. Masks are obviously not 100%. But all of us who are in the healthcare field have been wearing masks our whole careers, and I just wonder how many of these people who object to wearing masks would be happy if any of their surgeons decided not to wear a mask during this surgical procedure. I mean, maybe they would agree with that. I don't know, but at any rate, would anybody on the boards like to say anything else about Jim's proposed amendments here, either for or against? Before I would let it out, let's say to let some audience participation, if that's okay with everybody.
I like your spin on that, Charlie. That certainly takes the political aspect out of it, the masking during surgery.
Oh. It's certainly something to consider. I mean, I just don't understand the whole idea, but there is a lot of misinformation being promulgated. I understand somebody down in Alabama just died from the coronavirus who revealed that he was under the impression that, and apparently everybody in his town had the same impression, that the coronavirus epidemic was a hoax perpetrated by the Democratic Party. So that's what we're dealing with. Okay, so let's see, is there anybody in the audience who would like to, say something or contribute or put in something about the amendments or about the directive in general?
Can you address private parties like bar mitzvahs that
I'm
are,
sorry, can you say who you are, please, first, and then let me, and if you don't mind limiting your talk to 2 minutes so we can give everybody a chance potentially.
I'd like for you to address private parties, bar mitzvahs that are planned that now cannot happen without masks, or a private parties fine? Because you talked about people calling in about weddings and things that are now being canceled, room blocks being canceled because people are under the impression that they have to wear masks. Can this be for private parties? You're saying transmissions are within the households. Why are you stopping all these bar mitzvahs? And you mentioned weddings, and no other town nearby is, and you're losing business, and it just seems a little bit overreaching. People's private parties where people are vaccinated and showing proof of vaccination, to ruin all those events that.
Well, first of all, just before I turn it over to Jim to respond to it, I don't know if you were present when the data was shown a little while ago. About half of the people who are getting sick still have been vaccinated. And those people have been shown to be potentially highly contagious. And those people then, if they get are around other people, can potentially make those people sick. And one of the drawbacks of this disease, I'm sure that most people that object to masks would not object to stopping their car if they came to an intersection and they saw somebody in a crosswalk, because they know that if their car went forward and hit the person would suffer a lot of injuries or possibly die. The difference with coronavirus, unfortunately, is that if someone who is sick or has the disease spreads it to somebody else that they know, maybe those people, very likely because of the odds, there's only about a 3% mortality, which is quite a number eventually, because it adds up to 700,000 Americans. These people will get sick and then get better, and then they can laugh about it. They can say, gee, I didn't have any problem. Even if they've been vaccinated, they get sick. They'll say, oh, gee, this is fine. Nothing is happening. But what happens is then the next person down the line gets sick. They give it to somebody else. Down the line gets sick, and then eventually somebody dies. Now, the problem with the thing that people don't understand about this disease is that when they don't see the people that die, they think they don't die. They just don't seem to get that idea that what they do now at some private party or in some thing where they gather together with somebody doesn't have an effect down the road because they don't see it. So it's easy to be misinformed or misguided into thinking that it's totally a safe thing to do because the people immediately around you don't seem to have any problem. But it's down the road, and if you can understand it, so many Americans have died, as many Americans as all of the major wars in the 20th century and the 21st century put together. This is a huge number of dead people, but nobody who killed them really knows that they killed them. They just don't see it. So, Jim, you want to take it from there?
Sure. So to answer, and I'll do my best, because I think I understand the intent of what the board was attempting to do with this directive. And so if people read the directive closely, there's no enforcement mechanism. We're actually asking people to take their own responsibility. We're not issuing fines, and we actually haven't shut down events. We didn't say shall cancel. We're asking people to reconsider and possibly put mitigation strategies in. Now, I don't think I'm going to crash a bar mitzvah or a wedding or a private party on the weekend and start doling out masks and forcing people to mask. And I think we're asking people just to do the best that they can and put good mitigation strategies. And one mitigation strategy is maybe have a good guest list. And so in case there's a case, we can work with the nurses on contact tracing. And so the directive itself doesn't say you shall cancel. And so for a couple of places that, we got a call one day that from a bride to be that was upset that a place in Lenox, I actually called that establishment and said, we're not asking you to cancel weddings here. We're asking you to take some mitigation strategies. And while the directive isn't perfect, the last 20 plus months has not been perfect for anybody, including public health and the community. And I think I've seen pretty good compliance, and I think that's why we're amending the clarification of large capacity events. But even if you look at that, we're saying shall consider. We're not saying you shall cancel. And so what we're trying to do is come as close as we can for the community to rally. So I don't think we're expecting people to cancel bar mitzvahs and weddings and other things that are happening in the community. But if people
But
can
it
just
should be
take
a
this,
recommendation.
if I can just finish, please. It's just, I think we're trying to come as close to the vest as trying to remind people this is a serious situation and everyone just do their best of their power. And it's up to the board if they want to make any other amendments. And so so that's sort of my response. We're just, if places are trying to cancel, they should call us and we can work together on thoughts and ideas, but we're not trying to cancel everything. And I'm not aware of any businesses losing money for asking for people to mask. I'm not aware of any, but doesn't mean it hasn't happened, so.
All right, now there's a question from Steve Dixon. Steve, are you muted by any
Yes,
chance?
I'm unmuted. Can you hear me?
Yes.
Okay, great. I've read this whole piece of paper here, and I've got some troubles with it. Not so much from the point of I want to not have to wear a mask, but from the other side. I've been out to go shopping in supermarkets, and they have signs up saying you can't enter without a mask, but yet when I go inside, I see 20, 30 people not wearing masks. And it's just, I can't believe that this is going on. And this whole directive seems to not have any teeth to it. There's a section called enforcement, which I'm not seeing on the screen now. Is that taken out, or enforcement? Yeah, it looks like, from what I was reading of the first one, it looked like there would be some kind of enforcement. And I spoke with, I forget who, maybe it was
We spoke, Steve.
the other day, and he said, well, this is just a directive. But when you read this thing, it looks like it's a mandate. And if you go through Lenox or Stockbridge, these posters that you've handed out are they're not ambiguous. They're telling you, you got to wear a mask. And my real stickling point with this is that the small store owners that are trying to do their best and make sure that people are masked up and are asking them as they enter are going to take the brunt of this, because some people don't want to wear the masks. Now, the large stores aren't going to say anything. So it's like a double standard. You're either doing it and enforcing it, or you're not. And if it's got no teeth and no enforcement, I don't see, that it's going to be that good. I certainly don't want to get COVID. I am vaccinated, and I own a store too. And we request people to wear masks. And if they don't have a mask, we give them one. So I just would like your comments back on that.
Well, thank you, Steve. Anybody like to respond to that? John, what do you think about that?
I think, we meant it as a directive and not a mandate. So like Jim said, we have to do the best we can. As far as the the language about fines and that kind of thing. I mean, I don't know, Zach, what your comment would be on that, but you know, we didn't make a mandate knowing that it would be hard to enforce.
Personally, I've spoken with a lot of the business owners that have called. I've spoken with you, Steve, and like Jim said earlier, part of it is not wanting. A lot of people have concerns for their own safety when it comes to asking a customer in a confrontation at a business to put on a mask. So that's why we're asking everybody to do their best with it. We want people to mask up and be vaccinated and do their part, but we also don't want to put store owners in harm's way from a confrontation at a place of business where people should just be going about their business, you know? And that's my answer to that.
In my follow-up would be, you know, for someone who's done, you know, with COVID for the last 18 plus months, basically everything was shut down. And so did the state get 100% compliance? I mean, there were cease and desist orders out and manufacturing businesses and so on and so forth. It's never going to be 100%. I mean, I can tell you that I've been to, I'm not typically a person that will call out a store, but I was in Price Chopper in Lenox last weekend that's where I typically shop. The sign was up. Every Price Chopper employee was masked. And I would say 85% of the customers had a mask on. And there was a very few people that didn't have a mask. But, you know, if they're not wearing a mask, no one's going to force them to wear a mask. And I think, you know, if we can mitigate as far in as much of a high percent as we can, knowing that it's never going to be 100%, it's better than just everyone doing a free for all. And that's sort of like where we're at. If people can do the best that they can, it lessens the chance of people getting COVID and COVID spread. Are we in a perfect situation? Far from it. And I don't think this directive is a perfect solution to anything. It's sort of, you know, there's this weak advisory that some towns have done to the best of their ability in hope for the buddy system. You know, same thing with vaccinations and unvaccinated, and you should wear a mask if you're unvaccinated, but it's a buddy system. Well, if we look at the case counts with the Delta just blowing through our community, the buddy system isn't working out that great. But I think this directive is an attempt anyway, at least temporarily. This is not going to be hopefully a directive that's going to last forever. We're hoping to slow things down, rally as a community, and hopefully we won't need this at some point. But if we can get as many people to really take this serious, it's better than nobody taking it serious. And that's sort of my response to the directive, at least coming from the board. I mean, my responsibility is to implement what the boards of health want, and this is what they chose to do as a directive. And it's our job just to try to work with people to get out there. And there have been some businesses that didn't have to sign up at all. And so we're not walking into the store trying to find people. Zach's calling, they're emailing. It's a softball approach. Hey, we're asking you to do this, do the best that you can, call us if you have questions. And we've been met with pretty good response to that.
We have, and it also opens like a entry point for a dialogue with any business or member of the community that has a question. So I feel like it keeps the level of awareness a little bit higher, because somebody's always talking about it, asking us about it, and then we can disseminate all the information that we've been talking about tonight to whoever's asking questions.
I think the compliance in Lenox has been good from what I've seen in businesses in Lenox.
Any other board members want to weigh in?
I would weigh in briefly. The balance of an enforced mandate, virtually a law, versus the power that many of us have observed with a directive is hard to justify. The sheer resources necessary to create a meaningful enforcement are impossible in many views of the logistics. It's a little bit akin to speeding, which is against the law and is enforced, but when authorities aren't looking, people speed. And similarly, in a large grocery store, we're stuck. I mean, you'd need to post someone at each venue, really. One of the things that's worked in other communities is common sense reporting. So rather than, and the knowledge that, well, sure, it might seem like the small venue, the small stores is in some sort of, is losing out because they're enforcing, but yet many people, the perception could be flipped. It could be that, well, I know if I go in there, 100% are going to be masked because when I went in yesterday, it was that. And when I went into a large grocery store, it wasn't. And that kind of thing could very easily be true. We don't have data on what people are deciding. But the gist of it is that if you go to the courtesy desk or speak to any manager or supervisor, and if they hear that from 3 or 4 people, that anecdotal weight is going to take the day. That will help. So I would suggest a lot of discussion and interest in that sort of citizen reporting, not to the guy who's not wearing a mask, who's 6'5" and 300 pounds and clearly participates in professional wrestling on the weekends. Not a good idea. But the common sense, personal responsibility and pressure has paid off in many communities. And I'd hope for that here. I know speeding up and down my street, and there are 3 schools within a couple of blocks, is crazy. And yet it's illegal. Occasionally they'll post a police, and the same thing would happen with masks, even worse. So I really don't see a mandate turning into, a directive turning into an enforceable mandate because of the logistics and the realities involved.
Well, I would agree with that. And I'll just say that the grocery store I was in, where I saw so many, I was counting them like 25 people. And that was Lennox Price Chopper. I will not go there again. If you go to Guido's, everyone's wearing a mask. So yeah, I think you're right. There's the flip side to that as well. And thank you for listening to my comments.
Thanks, Steve.
It's interesting that Guido's is actually in Pittsfield. And stores in Pittsfield are not part or are not subject to this directive. And that's confusing to people. Guido's certainly does a great job in terms of getting masks out and protecting their customers. But when you go from a place like Price Chopper in Lenox to Stop and Shop, you're going from Lenox to Pittsfield. And unfortunately, that's very confusing.
Anybody else? Okay, now, so Jim, what do you propose about these amendments there? Do you want to make a motion that we adopt them, or does one of the board members want to do it? Do you want me to do it? Any further discussion about this by anybody?
Yeah, I guess if it's really open to the board to discuss, maybe if for a point of order, someone can make a motion to amend the changes as presented, then open it up for dialogue. And if there's no dialogue, you can entertain a motion to approve.
Anybody want to make that motion?
I'll make the motion.
Any second?
I second the motion.
Okay, thank you. All in favor?
Aye.
Can we have some discussion first?
All
Before
right, who made the initial motion? There's so many cameras.
was it Ray? Was that you that made it, or Carissa?
I did.
Who?
Ray.
Ray, and who seconded it?
I did, Joanne.
Thank you.
Okay. Thank you.
Thank you.
Anybody want to have any further Discussion about this amendment? Or these amendments?
If not, Mr. Chair, when you do a vote, you can just do a roll call vote.
I will. Okay, can we have people sound off and just give their name, whether they're pro or con, the amendment?
John Kearns, pro.
Hank Schwerner, pro.
Noel Blag, pro.
Ray Williams, pro.
Diane Romeo, pro.
Joanne Sullivan, pro.
Carissa Vincent, pro.
Bob Westphaser, pro.
Charles Kenny, pro. So I think it's a unanimous approval of the proposed amendments.
Okay, last question for the board is, I don't have any other updates. We're just about ready to adjourn. Do we want to reconvene in another month or so? I can send out a poll to look at the data again. That'll give us a little bit more. Hopefully the trends continue to go down, but I think a little bit more of a size to review data will actually put us in a better position to make decisions further down the road. I can send out a poll for like 3 to 4 weeks out, just to see where we're at and reconvene. Is that acceptable for everybody?
I
Yeah.
think.
Good. Sounds good.
Okay, all in favor?
Aye.
Aye.
Opposed? Okay, so thank you, Jim.
I'll entertain, unless there's not much else on the agenda, I'll entertain a motion to adjourn.
So move.
So entertained and so moved, and a second.